Hi everyone. We got some interesting statistics this week relating to the coronavirus and some of its impact. And we thought it would be good to share this week what that means for us as Alexander Forbes, specifically in structuring employee benefits programs. Firstly, the SA Medical Research Council updated statistics showing that there was a spike of deaths in July and August this year. So there's been an estimated 45,212 excess deaths. So that's more deaths compared to what we would expect in a normal season since the 6th of May. Now, although it's come down back to normal levels, there is a risk of a second wave coming. So there has been more deaths this year as a result of the coronavirus. And the future depends on whether that second wave hits and the extent of it. In addition, some statistics were released by TransUnion showing that a lot of consumers were impacted by the lockdown and the impact on their income. And it was also across provinces, so nobody was really spared. So that's had quite an impact on individuals, their income, what they can do with it, and them having to make very difficult trade-offs as to where they allocate it. Do they save? Do they keep their employee benefits in place, etc., etc.? And we've had a lot of questions from clients and been trying to assist them with that. The other impact is that statistics were released by 80/20, showing that there's a lot more individuals with, credit records that are in poor standing. So we've had another 500,000 more consumers who are unable to pay their loans in the second quarter compared to the first quarter. So also, and what's interesting is that the loans, in particular in relation to vehicle finance, has increased. So people have taken the relief offered, but it means that they've not taken on more debt. So people effectively have more debt following the lockdown. Now the impact of that is quite significant. And this is some statistics just from the SA Depression and Anxiety Group, which actually shows an increase in people feeling stressed post the lockdown and some of the key issues that they experienced. And we are starting to see this come through at our clients as well. A lot of this has implications for how we structure employee benefits. A few key takeouts for us and for employee benefits is that increased utilization of employee assistance programs. We've seen that at our corporates. And it's really important that individuals at employers know that those programs are available. There's also a very important need to focus on mental well-being going forward. That wasn't given enough attention up until now, and that really needs to be put forward. To manage the implications of that in the workplace and on their claims experience as well. We've seen an increase in death claims on group schemes, and there's also the potential for increased suicide claims in time, given the increased stress levels. We haven't seen it markedly yet, but it may still be something to look out for. There's definitely been a rise in disability claims, and there's been a big increase in premiums that insurers are charging for the cover of disability. And that's because of the mental illness, socioeconomic conditions, and the actions that companies are taking because of the lockdown. And that just illustrates why it's quite important to have things like an employee assistance program, manage mental illness, and manage all of those things to avoid further increases in disability premiums. Also, we're seeing presenteeism is likely to have increased at employers because of all these factors. People are stressed about their finances, which means they're not really focused on work. And there's also the potential for increased things like fraud, etc., at the workplace. Bringing this all together, it means that it's quite important that employers have well-run, comprehensive employee benefit programs, because these things are all interlinked to each other. They shouldn't be run in silos, they should be run as one. Speaking really to the one Alexander Forbes, and should include things like retirement savings, emergency savings, death and disability benefits, health benefits, and employee assistance programs, which, if done effectively, help manage the costs of some of your death, disability benefits, and health benefit schemes. So I hope you found this interesting. We'll be back next week with another insight. Thanks.